Hello students, welcome to the Paediatrics Pointers, your ultimate revision series. Today's topic childhood tumors, and we are going to discuss here is the brain tumor. Brain tumor is the second most common malignant tumor in children because overall the most common malignant tumor is acute lymphoblastic leukemia. Now, which brain tumor is seen in which age group? If you see in the infancy, the most common is the chorioid plexus tumor. In the childhood, 1 to 10 years of age, medulloblastoma more than pilocytic astrocytoma. In the children more than 10 years, diffuse astrocytoma. So, we'll be discussing regarding three major tumors. One is medulloblastoma, and according to the WHO, this is grade 4 by 4. Medulloblastoma mainly arises from cerebellum. On microscopic examination, you get is the small round blue tumor cells which are forming the Homer-Wright rosettes. In total, there are 4 types of medulloblastoma. What you should remember is most common type is the group 3 and the lowest risk of metastasis in the WNT type. Treatment, always there will be a surgery which will be done. Now, further treatment will depend upon what is the age, and second, whether it is a standard risk or whether it is a high risk. If the age is less than 3 years, after surgery, you give high dose chemotherapy with peripheral stem cell reinfusion. And what is important, we don't give radiotherapy. What is important, below 3 years of age, we are not giving is the radiotherapy. More than 3 years of age, standard risk. Standard risk means you are able to completely resect the tumor. There is no metastasis. There is no residual tumor left that is there. Chemotherapy plus standard radiation treatment, the total dose is 24 curie. More than 3 years, this is high risk. High risk means chemotherapy plus high dose radiation, 36 curie. So, what is to be remembered? Below 3 years of age, you are not at all giving the radiation therapy. So, this is we remember in medulloblastoma. Going to the astrocytoma, 2 types of astrocytoma can be seen in children, pilocytic astrocytoma and the diffuse astrocytoma. Pilocytic astrocytoma is grade 1 by 4. 1 means it is just a benign tumor. Most commonly arises from the cerebellum. If it arises from the cerebellum, the treatment is surgical resection. This is also seen in neurofibromatosis 1, where we say pilocytic astrocytoma of optic nerve, which is also called optic nerve glioma, no intervention to be done. In tuberous sclerosis, it is also seen subependymal giant cell astrocytoma saga, where you can give the drug everolimus and sirolimus. This is regarding pilocytic. The most common mutated gene is the BRAF gene. On the microscopic examination, you get a particular fibers which we call as the Rosenthal fibers. Diffuse astrocytoma is something grade 2 by 4. This arises from the cerebral hemisphere, right? That is the maximum you should remember regarding the astrocytoma. Ependyoma, grade 2 by 4 can be seen in the children. This arises from the 4th ventricle, and this can obstruct the flow of CSF. This can basically obstruct the flow of CSF, causing hydrocephalus. This can obstruct the flow of the CSF, causing hydrocephalus. Last year, craniopharyngioma, this is grade 1 tumor, and this basically arises from the anterior pituitary, so going to cause panhypopituitarism and visual changes. The treatment of craniopharyngioma is the surgery. There are 2 types, one is adamantinomatous, one is papillary. Adamantinomatous, just remember everything with C, catenin mutation, calcification 90%, cystic is there. Catenin mutation, calcification, cystic. Papillary particularly, BRAF mutation, calcification is rare, and this is the solid tumor. So, this was regarding in short the revision of the brain tumors. Thanks for watching. Do subscribe to the channel. Happy learning. Thanks.